What if your cat is already telling you something is wrong, and you're completely missing the signs? It's a scary thought, right? But cats are masters of disguise, especially when it comes to pain. Some of the behaviors we might dismiss as just being a cat are actually silent cries for help. Ignoring them can be dangerous. So today we're going to decode your cat's secret language. By the end of this video, you'll be able to spot these subtle warnings and know exactly when to take action. Let's start with the first, and often most overlooked, sign: sudden changes in behavior. If your once cuddly, friendly cat suddenly becomes aggressive and starts hissing or swatting at you, that's a major red flag. Or maybe your social butterfly is now hiding under the bed all day, avoiding you and the rest of the family. This isn't just moodiness or your cat deciding they need space. A dramatic personality shift like this is one of the most common indicators of pain, a hidden illness or severe stress. Think about it. If you were in constant pain, you wouldn't be your usual cheerful self either. So if your cat's core personality seems to have changed overnight, it's time to pay very close attention. Don't just write it off. Next up, let's talk about what's happening at the food bowl. Sign number 2 is any change in their eating or drinking habits. This one can be tricky because it goes both ways. Is your cat suddenly turning their nose up at their favorite food, eating way less than usual? That's an obvious concern, but what about the opposite? A cat that suddenly can't seem to get enough food, acting ravenous all the time, could also be a sign of trouble. This insatiable appetite could point to issues like hyperthyroidism or diabetes, and pay close attention to the water bowl. If you find yourself refilling it much more often than you used to, that increased thirst is a classic symptom of kidney disease or diabetes. So, monitor both how much goes in and how much they drink. It's a direct window into their internal health. Now for a topic that no one loves but is critically important: litter box problems. This is sign number 3, and it can be a true emergency. If your cat suddenly stops using their litter box and starts having accidents around the house, they're not doing it to be naughty. They're trying to tell you something is wrong. They might be associating the litter box with pain. Pay close attention to what happens when they try to go. Are they straining, crying out, or spending an unusually long time in the box with no results? If you see this, especially in a male cat, you need to treat it as an emergency. Urinary blockages can happen fast. They are incredibly painful, and they can become life-threatening within hours. This isn't a wait-and-see situation. If you notice straining or crying in the litter box, call your vet immediately. Sign number 4 is all about grooming. A healthy, happy cat is typically a very clean cat. So, changes in their grooming routine are a big deal. Have you noticed your cat grooming one spot over and over again, to the point where they're creating bald patches or even raw, irritated skin? This is called overgrooming, and it's often caused by stress, anxiety, or skin allergies. It's a physical manifestation of an internal struggle. On the flip side, what if your cat stops grooming altogether? A greasy, matted, or unkempt coat is a huge indicator that something is wrong. It might mean they're in too much pain to twist and bend, which could be due to arthritis. It can also be a sign of dental disease, making it painful to groom, or even depression. A cat's coat is a mirror of their well-being. Let's move on to sign number 5, unusual vocalizations or a sudden silence. We all know our cat's typical meows, chirps, and purrs. But what if that changes? A cat that starts crying constantly, yowling loudly, especially at night, isn't just trying to annoy you. They could be in pain, feeling disoriented due to a neurological issue, or suffering from anxiety. It's their only way to verbally express their distress. But just as telling is a chatty cat that suddenly goes quiet. If your normally vocal companion becomes unusually silent, it can be just as alarming. This withdrawal can signal that they are feeling very unwell, depressed, or are in significant pain. Pay attention to the soundtrack of your home. A change in your cat's vocal habits is a change in their story. Sign number 6 is a behavior that taps directly into their ancient survival instincts. Hiding. All cats like a good hiding spot, a cozy box or a quiet closet. But there is a difference between a cat napping in their favorite spot and a cat that is actively hiding from you. Pain and illness make a cat feel vulnerable. Their instinct is to hide away from potential predators until they feel better. So if your cat, who normally enjoys being out and about, suddenly starts spending all their time under the bed, in the back of a closet, or in any new, inaccessible hiding place, you need to investigate. They aren't being antisocial. They may be seriously unwell and are trying to protect themselves. This is a powerful, instinctual sign that should never be ignored. Finally, sign number 7, changes in their breathing or movement. This is a direct physical sign that something is wrong internally. Watch your cat when they are resting. Are they breathing heavily? Is their stomach moving a lot? Or are they breathing with their mouth open, like a dog? That is not normal for a cat and signals respiratory distress. Also, watch how they move. Are they limping or favoring one leg? Do they seem stiff when they get up? Have they stopped jumping up onto the counter or their favorite cat tree? This reluctance to jump or a change in their gait are strong signs of arthritis, injury, or other internal pain. These physical limitations are not just old age. They are signs of discomfort that can often be managed with a vet's help. So, what should you do when you notice one or more of these signs? The most important rule is, do not ignore them. Don't just hope it goes away on its own. Your first step is to become a detective. Track the behavior for 24 to 48 hours. Make a few notes. When did it start? How often is it happening? This information will be incredibly valuable for your vet. And that brings us to the most critical step. Contact your veterinarian. Early intervention is key. Catching a problem early can save you from more complex treatments, higher bills, and most importantly, it can save your cat from unnecessary suffering. Your cat depends entirely on you to be their advocate and to notice when they need help. You are their hero. Thank you so much for watching. Your cat's health is in your hands, and now you're better equipped to be their guardian. If this video helped you, please give it a like to help other cat parents find it.